The session we're doing now is effective ways of working with healthcare professionals. So we've got a little panel of the four of us, Lauren, Alex, and myself, who you know quite well by now. We've also got Adam Lynch, who has pre-recorded a video for us from Australia as well. So we'll start off with a few introductions and then we'll go to some questions and a bit of discussion. We might open up the floor to everyone later. So first off, we might start off with Alex, just to give a bit of an intro. Try and keep it to 7 minutes if you can.
Oh, no, I'll keep it short, as if I didn't talk enough already. But it's an important topic as well, because this is something that came up a lot from my member organizations, the interest of understanding not just how we work with healthcare professionals, but also how each of you work with healthcare professionals and how different ways of doing that. At the World Bladder Cancer Patient Coalition, we have been working with healthcare professionals from the very beginning. I think since the establishment, one of the biggest priorities was to build the relationships with medical societies, but also within individuals. So individual urologists, individual uro-oncologists, that's where we started. Now we are much more broader, and we built relationships as well with other specialties as well. And so just to go back to a little bit into individually how we've been working, we have together with the board, and early on we saw urologists serve as our gateway to reaching patients. As an organization, when we just got started, we had very little knowledge of the organization globally. And so getting out to the patients using urologists was one of the avenues that we used. This is where we established also our sort of more formal relationship with International Society of Urology, SIU. And we've had that going now for 4 years, I think now. It's pretty much for a long time. And that opened the doors for us to global urology communities from around the world. So I think the very first time we were the first patient organization that they offered space at their annual congress, where you have a couple of thousand of urologists coming from many countries. There's a big representation there as well from low and middle income countries. So this was actually the first congress where we had a booth that they opened the doors for us, and they welcomed us and gave us that opportunity. And I know that a lot of our members already do that. I know Melanie has presented this as well, and I know many of you others present at the congresses too. Some of you do not yet, and so this is why we're having this session also to learn how we could do that, how you could do that. And so since then, we've been having sort of growing opportunities with the SIU, with European Association of Urology, European ESMO, Society for Medical Oncology, trying to remember all the acronyms here, and working with these medical societies to bring our sort of presence into their congresses, where we meet with urologists, we meet with oncologists, we talk to them about our work, about the things that we do, but we also talk about you, our member organizations. So if we do have, I don't know, urologists visiting our booth from France, we will guide them to a French organization and tell them about Conservacy France if they didn't know about them. Then, since then, also we've been involved, collaborating with some key opinion leaders, as they call them, KOLs. So these would be specialists in urology, oncology, nursing, who are very well published and very well known, and they have very strong presence and the following globally, who also give us a platform through their network to give visibility to World Bladder Cancer Patient Coalition, to the work that we do, and also indirectly then to your organizations. And so this is where we can really sort of work together and help our member organizations to connect with healthcare professionals. I know that for Canvas, last year we had Dr. Ignacio Duran. He was at our forum, and he's been our supporter also for quite a few years. He's a uro-oncologist from Spain, from Santander. And so we introduced him with Lajon and David last year, and he's been a big part of the establishment of the group and guiding you through that journey as well in Spain. So I'll take a pause there now, and then I can fill in also other things afterwards as part of the discussion. Yeah.
I did some slides. Have you?
He got you.
Lynch from Bladder Cancer.
Okay. We'll have Adam later, not now, not now. Lauren just wanted to stress Theo out.
Are you sure you didn't get any slides from me? Your email's off. I thought I'd run some slides through. Thank you. I think one of the things with healthcare professionals, I think, so as an introduction, our organization started in 2008, and I was a lot younger and a lot more naive. And I'll never forget the first time we ever got into a meeting, we had to get a court interdict to get into a meeting where they were discussing the guidelines and what they would do for the patients. And we threatened them with a court interdict, and then they put us in the room, and they let us in the room. And then I'll never forget the girl that started campaigning for cancer with me. We got into the room and we'd fought so hard to get in the room, and we're like, oh my God, what do we do now? You know, because it was just us and all these doctors. And it was quite intimidating. But as we moved along, I'll never forget, maybe 8 years later, when I was in the same type of meeting, and all the patient groups were invited to it. And there were, in fact, more patient groups in the meeting. It was a breast cancer meeting than there were doctors in the meeting. And I remember that the professor of oncology, who he has personality failure every so often, and he was actually saying they'd done something and they had done a guideline. And I said, what about this? He was like, that's a really good idea. Yeah, we didn't think about that. And I was like, that's why we're there. Because as patient advocates, the doctor learns the clinical side of things, but there is an expertise to being a patient advocate. And it's not, you don't have to be the legal expert in the room, and you don't have to be the clinical expert in the room. You have to be the patient expert in the room. And I think that's something that often we as patients sit with, like imposter syndrome, and we shouldn't, because they're not asking us for our expertise in clinical knowledge. They're asking us for our expertise in patient advocacy and the patient experience.
I can add to that. So this is something that has also evolved our relationship at WBCPC with European Association of Urology guideline committees, where they are seeking input and patient representation, and they come to us for this. And so through that connection with them, then we're able to find the right bladder cancer patients to contribute to these guideline committees, as you described them so well. They come from within our community, from the groups within this room. So we've been developing quite a lot in this space now as well.
It's such an important sort of stepping stone in between all the different, specialists, and bringing a different lens, I think. So now I think we're going to have a video from Adam Lynch. He's the founder of Beat Bladder Cancer Australia, a group founded in Sydney, Australia. Thank you.
Hi there, I'm Adam Lynch from Beat Bladder Cancer Australia, and I'd like to give you a bit of an overview of what we've been doing working with healthcare professionals here in Australia. So it's been a bit of a journey for us, actually quite an interesting journey. Early on, we felt we needed to engage with health professionals, and we started looking at engaging with urologists, oncologists, and GPs, and nurses. Why did we feel the need to do this? Well, we needed to have, or patients needed to have, a trusted referral pathway to our resources and services. So if a nurse or a doctor tells a patient, hey, you should go and check out the information and resources that Beat Bladder Cancer Australia have got, then they're much more likely to do so. So we realized that it's the doctors and nurses that are in front of patients all day, every day, and therefore they needed to know about us and to trust us. So we tried various methods of engaging with the doctors and the nurses, and we made the decision to focus on nurses. And why did we make that decision? Well, out of those groups of healthcare professionals, they were the most keen and enthusiastic and wanted to learn. They were really engaged in our information. They're also actually the ones that are left very often to provide that information and support to patients. Once the doctor has had the consultation, then they often leave and it's left for the nurse to provide that support. So they're probably often the most relevant resource to know about information and support services. And we had limited resources from our organization. So we wanted to focus on where we could actually provide the best impact in terms of engaging with healthcare professionals. So we made this decision to really sort of work with nurses. So our first step was to actually raise our profile because at the time, a lot of the nurses didn't know we existed. And so we needed to prove that we were a trusted and credible resource that nurses felt confident and comfortable referring their patients to. And so how did we go about doing that? Because you've got primary healthcare nurses, you have hospital-based nurses, in the community and all over the country. So how do we go about engaging that nursing community? So we develop relationships with the nurse associations. I'm not sure how it works in other countries, but within Australia, there are a number of larger nurse associations where the nurses are members, and they, it manages their professional development and a number of other things. So we thought, well, let's actually develop the collaborations with the nurse associations, because if we do that, then we can actually access the nurses. So we reached out to the leaders of the nurse associations and started developing the relationship, told them about us, said what we did and how we wanted to work with nurses and why. We then also attended and exhibited at the Nurse Association conferences. So for a number of years now, we've been attending those in person. We have a booth and we're very active in engaging and talking and telling all the nurses that are there about what our services are. And that then gets nurses knowing about us. They then go back to their own hospitals or their own community and say, hey, we spoke with this organization called Beat Bladder Cancer Australia. They do some great things and have great resources. So you get that word of mouth sort of across the nurses. We also then we said, well, we can send brochures and information to your hospital or into your clinics. And so we would send out brochures after the conferences so that they could have in their display areas. So again, that was getting and building our resources within the clinics and the hospitals. So that has evolved over time. We continue to go to the conferences and we get different nurses attending the conferences each time, and then so it builds and builds and builds and builds our presence and awareness. Then what happened was quite interesting, because we were telling the nurses about patient information, and then the nurses were going, well, actually this information is really relevant for us. We find this helpful for us because we're not experts in bladder cancer. And particularly for early career nurses or nurses that are new to bladder cancer, or given all the changes in treatment options and at the moment with immunotherapies and targeted therapies, even experienced nurses were struggling to keep up with the latest treatment types. So they were finding this patient information that we had on our website resources really interesting themselves. And so we said, okay, well, what we can do is we can repurpose that information and make it relevant for nurses. And so what we did, we actually collaborated with each of the big nurse associations, and we got representatives from them, their nurse educators, to help develop the nurse education content to sort of repurpose the patient information into nurse information. And what we've now done is on our website, you can access, there's a section called Nurse Education. And it's all free, it's online, it's CPD, professional development eligible. And nurses from anywhere can go on and go through this formal program. It's about 3 hours of training through the patient journey. There are 2 programs. One is for primary healthcare nurses and one is for urology and oncology nurses. And so, so nurses can go on that and develop their skills and expertise in bladder cancer. What we then also do is in addition to that, which has been really well received, is we do Zoom-based education sessions for specific hospitals. So the nurse unit manager might contact us and say, can you do a session just for our team in this hospital? Or can you do a session for this area of community nurses? And so we do Zoom calls with their team where we have a patient and urologist doing an education session bespoke to the needs of that hospital. And we typically do maybe about 3 of those a month, and that's getting bigger and bigger now. So that's another way which we work with the healthcare professionals. So that's sort of hopefully given you a bit of an idea of our journey to get where we are, and the fact now that we're very entrenched with the nurse community, very good relationships, and an evolving education program with the nurses, whether it be face-to-face or through our website. And the other advantage is by working with these nurse associations and getting the information, we get accredited by those nurse associations. So all of our training content is accredited by them, and then they therefore promote that education to all of their members as part of their training program. So it becomes very easy for that training to reach all of the members. So I hope it's been useful and as a good input into your workshop, and the best of luck for your 2 days. And thanks very much.
Thank you, Adam, virtually, and thank you both. I'm really excited about this conversation, and we're going to have a little bit of a chat up here, and we're going to chat a bit with all of you down there as well. Because yes, I am a healthcare professional. I'm a GP or primary care physician from Melbourne. But I'm also a bladder cancer advocate, and I've been working in the bladder cancer advocacy and charity space for 10 years. So I sort of have this unique position that I sort of probably take a little bit for granted, where it's like, if I need a urologist, I just send them a text message and say, hey, I've got some patients, there's a pandemic that's broken out. They're worried about what COVID-19 means for their bladder cancer. These are the questions they've put to me. Can you answer these? And so that is quite a unique thing that I have. And it is a big advantage, and, it means that we can do quite a lot. But I'd love to see what, everyone else who doesn't have that sort of edge is doing. So I guess we might start with a question. I might start with you, Lauren. So how has campaigning for cancer worked with healthcare professionals to advocate for better bladder cancer care? And do you have any measurable impact to share?
So funny you talk about that inside track. So I had, my mother worked in pharmaceuticals for many years. In fact, she was one of the heads of an oncology department. So often when I used to go, I used to say, hi, I'm Bev's daughter. Then they go, Bev, how's she doing? And even still today, like I'll be speaking, she knew the person that's now the professor was the resident and the registrar that she worked on. And they'll be like, how's your mother? What she's doing? So I also had that, but I think it's a good tip to find a person within that you can say, so-and-so asked me, told me to speak to you, a referral person that's very well respected in the HCP community. That just so happened to be my my mum. For a long time, it was, I'm glad to say though, for a long time, I was Bev's daughter and now she's Lauren's mom. So I feel better about that. What has Campaigning for Cancer done? So we run a few projects that we look at. One of the projects is that when doctors are motivating for treatment to a funder or to a pharmacy technical committee, which is in the hospital, so depending on that, they have to write letters of motivation. Now, often those doctors don't have a lot of time, and then it falls to their staff to do it. And we have a group of people, and one of those people was here last year, Comfort, who actually write those letters. And it's so interesting to see that, you know, the doctors put the clinical stuff in, and then these guys put that advocacy side of it, the legal advocacy and the advocacy. And we have almost a 75% approval on those motivations. So it's bringing up the motivations on that. It's also providing patients, the doctors with a service that they've not had because they don't have the insight into the legal center. As I always say to the doctors, you know, that was a different class at university. The law class was next door to the medical class. It's not, and I think as we start doing things more with economics and that, those doctors are going to need more input. So that's some of the work.
I was thinking I have a question for you because you were saying, you know, you have your unique perspective of being a GP, general practitioner, and patient advocate. So you have an insight of how general practitioner practice and mindset works. How can we reach out better to, you know, primary care in general and to physicians to get that sort of awareness and socialize them a little bit to bladder cancer awareness?
Yeah, so I actually jotted a few notes about this because I was I don't know, I was thinking sort of a few tips for patient groups. So I guess one of the things you can do is basically find out who is the main bladder cancer urological surgeon in your town or state. So for example, in Melbourne, we have Dr. Nathan Lawrence-Chuck, he's the big bladder cancer guy. Everyone knows he's the bladder cancer guy. He's doing all the bladder cancer surgeries. If you're a urologist who specializes, say, in prostate cancer, and your patient then has bladder cancer, which is actually what my dad had. He had 2 primary cancers, but he survived the prostate cancer. But his urologist for the prostate cancer didn't do many bladder cancer operations. So Dad went to Nathan. So I think if you're not sure who that is, if you don't know, one of the things you can do is contact your own GP and just say, because GPs sort of know part of our job is obviously we're doing referrals all the time. So people will say, I've got this skin problem, I need to see a dermatologist. Or you might get a female come in and say, I've got this skin problem, but it's on my vulva, so I need a vulval dermatologist. So we get these kind of nitty gritty areas of who's an expert in what. So I think going to a primary care physician and saying, who deals with bladder cancer in this town? Who's taking out all the bladders? And then going from there. And you can contact them either via the hospital. There's usually junior doctors on their team in the hospital, so they would be the point of call. Or if they have private rooms, they will have their own secretaries and their own administrative emails and things like that, where you can just go, hey, I'm from this advocacy group. We would love to get some urologists involved. You're the big bladder cancer player in town. Are you interested? And if they're not, you could say, do you know someone who might be interested?
Or invite them as a key opinion leader to one of your events, get them to talk and, you know, have that. It's creating the relationship. They're seen as they've got something to add, that you want to hear what they have to say. I think that's also, we've built a lot of relationships like that.
Sorry, that's me. I would say also maybe when you're just starting out and maybe you haven't had opportunities to connect with these people yet, it might seem scary, you know, especially these people published many papers and you see them speaking everywhere, etc. But From my experience, majority of them are very humble when it comes to working with patient advocates, and they're really interested to help. So reach out and try your luck, and I'm 90% sure you will be successful. Theo, I think Eva Maria raised their hand. Can we get a microphone to her? So yeah, I know it might be scary, and the same thing goes with policymakers as well. Okay, their interest to help is a little bit different, but take that step. Take that outreach, and more often than not, I think urologists, oncologists will be very happy to come contribute in whatever way they can.
Yeah, and I think doctors are they're just other people, like I'm a doctor, and most people I walk down the street, they don't think I look like a doctor because I'm not in the stereotypical box of what a doctor would look like or what a doctor would wear or how a doctor would act. And I actually think that's kind of an advantage for me. I work a lot in youth mental health. So I see a lot of teenagers who are struggling, for example, who wouldn't go see, your typical doctor. So, I think they'll be, like Alex says, more than delighted to chat to you, and they get excited when you're excited about something as well.
Just to add also, and the way that, sometimes you can approach physicians, let's invite them to give a conference or an interview or something online to, raise awareness or something like this. You start that way. You don't ask something related to advocacy, but you ask his expertise or her expertise to talk, about bladder cancer or a topic specific. And when you send a letter or the invitation, you say, you are the expert. We need you, and that makes the thing.
I know. Exactly. So Alex, we might ask you a question. What do you see as the key elements needed to build a strong, lasting partnership between patient organizations and these healthcare professionals?
Well, the first step is definitely to reach out, right? Take that first leap, first step, and reach out to these organizations, to individuals, or I would also recommend reaching out to national societies too. Let's say if you take, Adam mentioned National Nursing Society, or it could be National Urology. Most countries, you'll have some sort of urology society. I think even in Dominican Republic, this week there's a big Latin American Urology Congress taking place, and I think it's co-hosted by Dominican Republic Urological Society or something like this. Yeah, and so these societies are often also governed or driven by individuals who already have good reputation and good interest to do more beyond, let's say, their daily practice. So you can also go through that avenue and try to build relationships, see how you can work together. Because through them, you can also go out and disseminate the resources, use them as your sort of bridge to information dissemination. So then through this society, we'll let all of the urologists, most urologists will be a member, for example, of these societies, and they can help you disseminate your information. So going through them, I think it's also, as Eva Maria said, recognizing their expertise and recognizing the value that they can bring to your community, but also in the long term, also looking how it helps them to raise their profile, maybe that they do more with patient advocacy or that they're working, let's say, internationally. I think that really helps. And also they would be, some of them, and I think as your relationship evolves, you will be more likely have more opportunities to contribute maybe some of the research work or some of the other activities that they do that are more healthcare professional focused, but they would like to bring in a patient voice in some way. Go and contribute to these. And lastly, I would say also be comfortable with saying no, because sometimes you will get requests after requests after requests of things to do, both from healthcare professionals and other people. But to be a reliable partner is also being able to say no when you know you won't be able to do it or you don't have the capacity to do it. And it's okay. It's better to say no than overpromise and then not be able to, to meet meet the expectations where they were, relying on your input for that, for example. So I would say, yeah, those are probably some of the key elements.
Lauren, did you have anything to add?
Yeah, I think one thing for those people that are starting out is, or even just getting involved with that, is that there are different personalities, and sometimes some healthcare professionals don't see the benefit or have not been exposed to advocacy and patients. And sometimes they might seem dismissive of you. And that's okay, because that's on them, not you. That's on them. They don't understand that. And maybe one of your things is to say, you know, I'm going to teach this person that I do know what I'm talking about, and I do know. But there are always doctors that are willing to work with you. So find those doctors and work with them. And sometimes it'll be those doctors that'll be the advocates to the other doctors. So not every doctor is going to work with you. Not every doctor is going to see the benefits of advocacy. Not every doctor is going to be willing to walk with you and walk the plank. That's fine. It's not your fault. It's not, you didn't do anything wrong. It's just that's people are people, and he doesn't see it. It's not his focus.
Yeah, I think it's funny because I first heard about fight bladder cancer from a doctor presenting at a conference, 12, 13 years ago, long time ago. And I'd never heard of them as an advocacy group, but they literally put them up and was like, oh, I was in the UK and this amazing group is doing these crazy T-shirts. And I was like, wow. So, it brings, again, credibility, because other doctors are like, oh, wow, that's great, and then sort of spreads on. I thought I might just touch on, there were some sort of questions around sort of partnerships between healthcare practitioners and advocacy groups. So I guess myself at BCA, so our group has paired with various hospitals. So in Melbourne, so some of the bigger ones, there's Peter Mac, which is a big cancer hospital. Also the Austin, which has a big urology unit. They do a lot of research. Nathan Lawrence Chuck works at both of those places. So we've done events together, and that means that you're doing these events. There's patients there, there's advocates there, there's GPs, there's urologists, there's the nurses. You might all be wearing the T-shirt. People are taking photos. It's on their social media. It's on your social media, and people are asking the question. It's actually really, really powerful and spreads, quite far and wide. Other things we've done is research together. So a lot of these big hospitals that are doing a lot of research, they're so keen for people to get involved, and they might have all the ideas. Oh, I've got this amazing idea for a research project, but we just need the minions to do it. And people like junior doctors are keen to do it because, for example, they want it for their CV and that sort of stuff. But yeah, so I was involved with the team at the Austin, and that's when we did the hematuria guidelines. So it was myself and a few urologists, and I kind of gave that GP and patient advocate perspective, and they gave the urology perspective. And we had that published in a journal. We had the brochures made. I presented it a couple of years ago in Paris. So you can do actually quite amazing stuff just with a small team, but small but sort of potent team, Yeah. So it's been amazing.
And the survey that got mentioned over the last couple of days a few times. So when we first started out, we built an expert advisory committee, which consisted on some different healthcare professionals bringing in their expertise, because we were also newly established. We have patient advocates' voice and view in that, but we needed that medical expertise, research expertise. So they really, we had 10 people in total in the expert advisory group, half of which was patient advocates. So let's say 5, 6 experts in different fields relating to bladder cancer who have, donated their time and they attended these meetings and helped us craft the survey questionnaire in itself and the report and following publications. And they continue now to even do other sub-analysis with us on the survey data and submit those to their own urology congresses as authors together. In a couple of weeks, I'm presenting a sub-analysis from our survey on patients with advanced metastatic disease at the SIU Congress. And I know that we've also submitted at American Urology Association, I think it's AUA meeting as well. So they're really helping us to write that sort of medical writing part and submitting these abstracts and publications, which was truly helpful. And you've mentioned, I just wanted to go back a little bit, what you've mentioned about them joining your meetings or participating and sharing. Social media was so powerful as well for us, where they share our things that we do, attend our meetings, make one social media post, but these people, especially key opinion leaders who have a big following, it's really trickles down to then their interest and engagement from people who follow them. So it's really wonderful resource.
Yeah, and the other thing I'll just mention, and then we might open it up to the floor a bit, is Adam was talking about the brochures and how the nurses love the brochures. Doctors love the brochures as well, because the way we use, you can imagine our head is full of all this like nitty gritty pharmacology and drugs and all this information. But then we might have someone come in and we need to explain to them, what diabetes is, for example. And we need to wind it back without using the jargon, without forgetting anything about diet and lifestyle and genetic. We've got to just make sure we're ticking all the boxes and not going a bit crazy with, like we're talking to another doctor. So I use them all the time for everything. Like I'll just look it up, back pain, patient fact sheet, and I'll sit there and go through it with the patient and say, okay, this is the things you can do. This is what is probably not so helpful. And I find them, and other doctors find them amazing. I mean, when I was sitting for medical school, you do your written exams, and that's all the nitty gritty. You can't mess it up. You got to pick the exact dose or the exact drug. But then you do the practical exams where you sit there with an actor and you go through 20 little stations, and they want you to tell someone they've got cancer. They want you to explain this investigation. And we actually studied to do that with the patient fact sheets from various organizations. So
Yeah, I think another thing also is that we always talk about multidisciplinary teams to treat. Don't only look at the oncologists and the urologists, because medicine divides the body up into parts. Patients don't. So the patient is going to tell their gynecologist about their bladder, that they're having that when they go. So often, I learned this with a brain cancer, where they told us to invite dentists to a brain cancer. They're like, yeah, because the patients, it's in that they're doing. So it's you got to be a little bit outside the box when you think about who you're going to speak to. Speak to the dietitian, speak to the physiotherapist, speak to the, audiologist, things like that you're going to start looking at, and including different people. You don't only have to look at the surgeons, the urologists, and the
palliative care is often overlooked. And,
Yes.
when we're talking about those advanced metastatic patients, palliative care isn't just the dying process or dying comfortably. There's a lot of symptom management in palliative care. So there'll be people who have like quite a good life expectancy. They've got a terminal illness, but they will be seen by palliative care to, manage the nausea, manage the pain, manage the, so they're really often overlooked, but very powerful specialty as well. Anyone from the floor have anything they want to add or comment? Yes.
Hi. So I mentioned earlier about us going to conferences. So initially, that's how we met a huge amount of the professionals. We also, not just the nurses, so we went to the surgeons conference. So we had to try and find sparkling personalities to entice them to talk to us. It's very exhausting, but these conferences are very expensive. So there is another way. I know that everybody in Europe, and I know I'm not part of Europe, but never mind. So you can apply for a patient grant to go to these conferences. And so I started doing this after I met Lydia, because I didn't know about this. And there's certain urology conferences that you can apply to. And when you get there, there will be other patients, like us there. And an example of what happened was that you can go to the talks and listen to the talks. And Professor Palu that spoke yesterday was at one of these conferences, and he spoke about a particular situation. And I've been trying to support this lady with a horrible situation. I wanted to speak to him and ask his opinion on something. So at this point, after they've spoken, people tend to gather around a little bit and chat to them, and you have to pluck up the courage, and it's quite hard because I felt a bit like an idiot, and ask them. You've got a really good opportunity, and they're quite like that because they've done a talk, they've put the effort in, and for people to go and ask them things is good. You can, even if you've got the confidence, stand and ask them a question. You have to introduce yourself, say who you are, where you're from. And that's a really good way of getting to know people. It doesn't cost, you'll get your transport paid and your hotel up to a certain amount. And they're really interesting events as well. And you can meet so many other people and chat and learn things. So that's a really good way of doing it in Europe. Maybe they do that in other places as well.
And that, I feel like that gets easier with time. The more you do that at a conference, like go up to someone and ask them a question in that sort of casual way, it just becomes much more natural. And then, you know, it's like anything,
it was so
isn't
helpful, and it
Mm.
had such a knock-on effect because his you've heard the kind of surgeon he was. He's very different to most of ours, and I was able to tell this lady the information he gave and support her in changing hospitals because it was a terrible situation, with the confidence that I gave her from a specialist. You know, where else can you do that? That's your opportunity to get a foot in the door, I think. And it's helpful as well, really, you know.
And so you have these two grants that come to mind that Melanie mentioned. So European Society of Medical Oncology offers patient advocate grants to travel to their congress. They have a patient advocacy track, but also then scientific parts that are worth attending. And then there is European Association of Urology, which is also has opportunities, some small grants and opportunities to be present at the event. So these are European congresses, but they do have sort of international attendance, and I would definitely encourage you to stay alert, because we do share these opportunities via the newsletter as well from the World Bladder Cancer Patient Coalition, and we can also help and guide you how to go through that process and how, I cannot guarantee that you will get it, but I can definitely help you find the right information and do it in the right way so you have the best chance of doing it and joining us in these events. Because this is a good, like, just to add, Melanie, all the things that you said are correct, and it's the exposure and the connections that you can really make to healthcare professionals from your countries. And these are often also, you have healthcare professionals who are, key opinion leaders from your own countries, and then also others who are there to learn, etc. And so they are all there. They tend to always be at these congresses, and so it's a great opportunity to connect.
And don't be afraid to name drop. So seriously, like if you go to, if you meet someone in your country and you're like, oh, I was at a conference, Paolo, he was there, and everyone's like, oh, you were there at a conference where he was.
Yeah.
Yes,
Yeah.
we were like this.
Yeah. Oh, Laurie?
Yeah, I'd just like to share something that we did at Conservatie France that was effective in working with healthcare professionals. In Awareness Month during May, one of our events, we had what we call a Patient Information Day. And I think that we had about 10 speakers, urologists and oncologists. And they gave presentations on different subjects related to bladder cancer. And what we did is part of the day, we had prepared a list for them of frequently asked questions. We have in our patient group online on Facebook, we have often the same types of questions that come up.
Yeah.
And so we just kind of compiled those questions and we asked the urologists and the oncologists. And so then we now have video clips that we can use to refer patients to when those same questions come back
That's
up.
fabulous. What was the turnaround time for that?
We actually haven't quite finished
Oh, yeah.
putting all the video clips.
The videos aren't
up,
made there, in theory.
but it's a long-term thing.
Yeah. And I think that's one of the challenges. We were talking about sort of that, intimidating people and then time poor people, difficult to contact. But I think once you kind of, like Melanie was saying, you ease your way in, your foot's in the door, then they'll see you at a conference and be like, oh, I remember you, like you came and chat to me, like, amongst the sea of everyone else. It really gives you an advantage, I think. But maybe we could compile like some of the grants that are specific, make a list that might be useful for everyone? Otherwise, I'll just email
Yeah.
you and ask you.
No, but I try to proactively inform everybody as
Okay.
well to
Yeah.
these. There's some other opportunities that come along, and as I said, we try to communicate this through a newsletter, but sometimes direct emails as well to our members. But now, as I mentioned, we'll have this platform for our members to connect with each other and with us. So hopefully, we'll have even more ways to learn about this. I certainly know all of them already that I know of.
Yeah.
So I keep an eye out and letting you know about this. There is also more congresses, so not just European ones. It's an ASCO, American Society of Clinical Oncology. They also offer grants. These grants are usually not enough to cover all of the costs, unfortunately, but it can cover a part of it, and sometimes you still need to put something for it from your own side. I always keep an eye out also for other regional congresses, so like the ones in Asia, LATAM. A lot of them are still not at the stage of that you see in Europe, where patient advocates have free or very, very low price registration to attend these congresses. And then also same goes for the grants and things like this. I know that ESMO Asia is now taking place this December, and they starting to have something new for targeting patient advocates. Yes, Lydia.
So the American Society for Clinical Oncology, which has their meeting in June every year, they offer free online access to patient advocates as well. So you just need a letter to say that you're a patient advocate, and the World Bladder Cancer Patient Coalition can give you a letter if you cannot get one from your local organization as well, and then you can attend for free online.
Yeah, wonderful.
We can follow really the latest science as well.
Find out who the key opinion leaders are.
Find exactly, see what they spoke about. I think there's an online interaction option even, so you can ask questions and then write up who you are.
Great. Any other questions, comments from the audience or online?
Do we have anything online at all? Any questions? No? Okay.
All right.
So yeah, I think the one thing though is I've surprised doctors more than they've surprised me, and that's one thing that we as advocates need to learn.
You surprised me too.
But it's that you do have, and I want to express this, you do have an expertise. Don't be afraid to speak about it. You know more than you think you know, and those doctors are just as shocked by it sometimes on that. And I've had lots of doctors where you can actually see them go, oh, patient advocate. And then as you speak, they're like, oh, hold on, wait. Oh, she actually knows what she's talking about.
Yeah.
Like and I'm not talking about anything. I haven't studied anything. I haven't done anything. It's just the experience. It's the experience. And that's all you have to bring to it. Because at the end of the day, you and the patients are having experience, you and the doctors are experiencing and walking down that road. So you're going to have commonalities when it comes to each other, because you've both walked down the road with the patient.
Yeah, absolutely. Thank you, Lauren and Alex and Adam virtually for having this session. I think it was really good to have a chat and see what most people do to get in contact with healthcare professionals.